Good morning, good morning, good morning, good afternoon, or good evening. Thank you so much for joining us for yet another IFRC America's Twitter space. And we've been talking about mental health all month, all October. And we are celebrating the month of October actually as Mental Health Month. Now, if you've been with us for the past few weeks, you would know that we have been hosting a Twitter space every week. On Thursdays, we have them in English, and on Fridays, we have them in Spanish. And so today, we will continue with our Twitter spaces in English, and we will be talking about mental health and children and adolescents. Now, we've covered already mental health with older adults, we've covered mental health and anxiety, and we've had several guests share with us different tips on what you can bear in mind when dealing with these different groups. But today, we're going to be focusing on the young ones. And here with us to tell us more, we have Mrs. Marcia Gooden-Weathers. Mrs. Gooden-Weathers, or Marcia, as she's called, she has actually worked for over 10 years as an associate clinical psychologist in public and private settings. Now, for most of her professional career, Marcia has worked closely with children and families, and she has carried out counseling, psychoeducational assessments. She has co-facilitated social skills groups for primary school age children, and she's also a lecturer at the Northern Caribbean University. So who best to talk to us about this topic? Marcia, welcome. Thank you so much for being our guest today. How are you doing?
Hi, Trevesa. Thank you so much for having me. I'm doing well. I am looking forward to the conversation. It's really a timely conversation that the Red Cross has initiated. So good stuff. Good to be here.
Yes, and we're happy you could be here. Now, tell us, Marshall, we've had so many issues just over the past couple of years alone. The COVID-19
Hmm.
pandemic has had several severe effects on different groups of people, but especially our children and adolescents. And then we have also have some who have been orphaned by the pandemic, some who have been pushed into adulthood prematurely, either because they have had to become the head of the household or breadwinners, not just for themselves,
Hmm.
but for their family members, for their siblings. And then we have so many others who are in the process of migrating, some persons who are living in communities that have been seriously hit by the socioeconomic effects of the pandemic. So all of these different issues are happening. And in addition to that, we also have the climate crisis, issues with hurricanes and
Hmm.
flooding and just so many different things happening. What are some of the mental health effects of all of this on our children and adolescents, especially those who are most vulnerable?
Okay. All right. There are lots of ill effects from those contemporary issues with the climate change, the pandemic, and so on. But we need to also realize that even before the pandemic, Travisa, the mental health of our children and adolescents was a concern. So we also need to add that to the mix as well. Because with the explosion in the use of social media as that main way in which our young persons communicate with each other, they were already at risk for certain things like sleep disruption, cyberbullying, lowered self-esteem, that they're already at a risk for some of these mental health issues, even before the pandemic, you know? And then increased levels of anxiety and feelings of depression were already being reported, and a lot of it was associated by use of social media. And then coupled with that, just a period of adolescence can already be a challenging time. We're talking about a lot of bodily changes, emotional and relationship changes that are occurring at this point in life. We don't even have to go into the peer pressure and the experimentation with drugs and illicit activities. So the time of life of being a teenager and childhood by extension is already challenging. Yes. And as I was doing some reading for our conversation, there was actually a report done by UNICEF called The State of the World's Children 2021, and they had actually found that 16 million, 16 million adolescents, which are aged 10 to 19 years, were actually living with a mental disorder. And they actually collected those figures in 2019. So this is a little bit before the pandemic, but we can see that there was an issue even before before we went into the lockdowns and everything that COVID-19 brought. So we were seeing that mental disorders were already a challenge, and we had about half of those adolescents, based on that report, that were actually living with anxiety and depression. So what we have, Trevisa, is an already vulnerable situation, an already vulnerable group, our children and adolescents. So the pandemic, when that occurred, it really just exacerbated all of those issues that were already there based on the instability and the unpredictability that you were just referring to. And then and then because we had to use even more social media because learning started to become more remote, yes, that would have further exacerbated some of these mental health issues. So we're talking about increased feelings of isolation, increased feelings of loneliness, loss of social contact, yes. And then what you mentioned before with some of the children who may have to be fending for themselves more now because their caregiver may have passed because of the pandemic. Maybe one or two caregivers could have passed. So we have what we call more parentified children, quote unquote, parentified. That's just a term that means that the child starts to take on more adult roles. So we're in a state where some children may not really be able to really fulfill all that they can fulfill as a child just because of all of these issues, right? And then another survey, and this one was conducted in Latin America and the Caribbean. This one is the U Report survey by UNICEF. They actually found that 27% of young people within our region felt anxiety during the pandemic. So we're seeing so many issues. And then you can just imagine, Trevisa, the more vulnerable groups. So these will be children who may be living in juvenile facilities, maybe like a children's home, or those who were already facing poverty, or maybe experiencing a chronic illness, a non-communicable disease from before. We would see similar mental health challenges with them, but chances are the rates would be higher just because they're even more vulnerable than other persons in that age group. So there is the problem is real, and there's a lot of work for us as adults who interact with children to really do.
Wow, yes. Thank you so much for painting to us that picture. It really is a lot that our children and adolescents have been dealing with. And that those statistics that you shared are just mind blowing. So with all of these things that are happening, Marshall, can you tell us how can we be more empathetic to children and adolescents who are going through these mental health struggles? Because this is a lot to unpack and it's a lot to deal with. So how can we be more empathetic as adults to this age group?
Right. Definitely a lot to unpack, and that's why I really do want to commend Red Cross again just for this initiative. And then, so let's look at empathy a little bit, right? What is empathy really? So we're talking about being better able to understand the emotional experience of someone else, almost as though you were that person, right? So you might have heard the term putting yourself in somebody else's shoes. Is that kind of thing? But we're talking about it from an emotional viewpoint, right? So as adults, at least in our culture here in Jamaica, at times we are very quick to tell children what to do, right? And even tell them what they should be feeling, right? So we're very big on giving instructions and taking charge of the child's life and how it should be. But in order for us to be empathetic, it calls for us to take a step back and actually ask the child how it is that they're feeling. So as adults, and each of us would know a child, yes? So as adults, it's important for us to get curious about how the child is feeling. What is the emotion that that child is experiencing? And then take it a step further, because sometimes our children may not even have that language, the words that they need to tell us what those feelings are. So sometimes we can assist the child to putting a name on it, right? Are you feeling happy? Are you feeling sad? Are you feeling upset about something? Are you afraid? Yes? So we want to build that emotional vocabulary for the child, and so that can allow that when we ask them how they're feeling, they can better express themselves. And another thing that's going to be important for us to do is to really put our initial reaction to the side so we can actually focus and listen to whatever that child's emotion is, right? So I'm not saying you have to ignore your feelings and not pay attention to them, but in order for you to show empathy with someone, the focus is less on your own emotional reaction and you're really trying to focus on the other person. Yes, so you're putting your feelings aside for a bit and you're just trying to focus on what the child is saying, just listening to what it is that they're sharing with you. And another way in which we can communicate is by using up our I statements. So let's say a child is sharing that they lost their caregiver or a family member because of an illness, possibly COVID-19. So you could say something like, "Well, I can only imagine how difficult that must be for you to manage since your uncle died from COVID." Yeah. So you are letting the child know that you understand where they are. Yes, you may not fully understand everything, but you're letting them know that they are not alone and that you can only imagine, the challenging experiences, the challenging experience that must have been for them. And then the last thing that I would share in terms of helping us to be more empathetic is for us to not be so quick to fix whatever the child's problem is. So yes, a child may be feeling sad. And let's go back to our previous example. The child may be feeling sad because someone passed, and we may want to maybe give them something to eat or give them something to watch on a device to help them to feel better. But maybe the child doesn't need you to fix it. Yes? Maybe the child just needs you to listen and to be present and just to help them to process what it is that they are feeling. Yeah? So those are some ways we can practice empathy.
Wow, so many things to remember. I mean, this is really good advice, Marsha. Thank you so much for sharing all of this with us. But we also want to find out as well for people who are working to assist children and adolescents in vulnerable situations, what suggestions would you give to them so that they can better support the mental health of this vulnerable group?
Okay. All right. And it's interesting that you're asking about workers, but in a sense, we're kind of all working with children. Whether we're a teacher, whether we are a coach at school, right, or a godparent, a healthcare worker, or maybe just walking on the road and you see a child. You're a community leader. In a sense, we're kind of all working with children. There's a saying that we use locally. It takes a village to raise a child. Yes. So each of us should look out for a child. Look out for that child, that neighbor's child, even if you're not necessarily working with that young person. So, in order for us to really be able to assist, I have just a few tips here. One of the first things we want to do is to engage in self care. And this may sound a little odd, but the thing is, we can't really assist others. We can't really assist others if we have not already assisted ourselves. We can't pour from an empty cup, quote unquote, right? So it's important for us to take care of our own emotional health, be a model of what that looks like to a child, yes, so that we can better able assist and attend to that child's needs. Because sometimes, yes, we want to help the child, but if the child is only seeing us being, very upset and not being able to manage those kind of intense reactions, how are we really going to be able to assist, right? So it's important. The first thing is for us to engage in that self care so that we can model proper ways of coping with mental health challenges, right? That's the first one. And the second one is to just check in. Check in. So check in with the child that you are familiar with. Listen to what they're saying. Observe any changes that you're noting in their behaviors. Sometimes a child may not say how they're feeling. Sometimes they may not say, "Oh, I'm feeling depressed," or da da da. But maybe you can pick something up, right? If you check in, if you listen, if you observe. So that's my second point. Check in.